Welcome back to Your Health radio and television program. I'm Dr. David Morwood. I am a board-certified plastic surgeon, and I'm so happy you could join us for this segment. My next guest, Nurse Natalie Harris, RN. Well, Nurse Harris, thanks so much for being here. I appreciate you coming on the program.
Thanks for having me.
Now, I want to talk about what you're doing now, and then I want to back up a little bit and talk about your training and how someone gets to be a registered nurse. And then we're going to talk more about important issues and things that we do in the recovery room. And I understand right now you're a recovery room nurse, otherwise known as a PACU nurse, and we'll talk about that. So, Natalie, let's talk about what you're doing now. Now, tell us what a PACU nurse is, or a recovery room nurse.
Okay. Well, we call it PACU, but it does stand for Post-Anesthesia Care Unit Nursing. And we are responsible for admitting the patients prior to surgery and then recovering them from their anesthesia afterward as soon as they're done in the OR. So
that's a very important part of the perioperative experience, isn't it?
Very important.
You know, Natalie, most of the viewers and listeners know that I'm a board-certified plastic surgeon, and so many of them are concerned about the anesthesia almost as much or sometimes more than the operation that they're planning.
Absolutely.
Which continually surprises me, but then again, I do understand it. So before we get into the nuts and bolts about what goes on in the recovery room and how you get a patient ready for the operating room and how you help to recover the patient after the operation, let's talk about what someone goes through in order to become a registered nurse and RN. Now let's imagine that we have a smart high school student, a young woman or a young man, and they think that they might want to become a registered nurse. And so let's describe what they do to train to become a nurse.
Well, there are still currently several options to become a registered nurse. There's still a few what are called diploma programs, which are directly through a hospital. You don't actually earn any kind of degree, but it is a certification. They're becoming more rare, but that's probably the simplest way, and I think you are actually paid at the time. A lot of times I think people will start as a nursing assistant but go through a hospital program. They're very rare, but most people go through a community college or a junior college and earn an associate's degree.
Okay, so let's back up for one moment. So everybody's got to finish high school,
yes.
Of course,
Yes.
right? And I think in general, people who go on to nursing are pretty good students, right?
Definitely.
Certainly they've got to be able to
some
study.
scientific inclination, mathematic inclination, but,
Right.
and obviously a lot of people and social skills is a must.
Well, I think that's important because I was about to say they've got to be good at science and certainly verbal and writing skills. But you just mentioned as well that they've got to be good with people.
I think that's almost number one in this job, because the thing of nursing is you are dealing with people all day long. You're often dealing with them at lower points in their lives, you know, when they're vulnerable, and so you need to be, you know, very understanding, but also just very pleasant all the time and upbeat, and you must like people to do the job for sure.
Natalie, I appreciate you bringing up. That's a great point. So again, for the student who's listening, they've got to finish high school, and then there are a number of routes they can take to go on to become a registered nurse. Okay, so you mentioned they can, but it's rare these days. They can get a training program in a hospital to get a certification.
That's going to be in a metropolitan big city area hospital. We'll still have some of those programs.
Okay.
But I think most students will go through a community college, and you can get an associate's degree in nursing, and that will qualify you to take the national board exam for nursing. You can also go through a bachelor's program, and again, that is becoming more and more popular. It's being more encouraged because a lot of employers want to see that bachelor's degree nowadays, and it can lead to management opportunities in the future, but it's not a necessary prerequisite to earn the registered nursing licensure.
Okay, so I think that's what you call a BSRN, is that right? If they
BSN, Bachelor's of Science in Nursing.
Bachelor's of Science in Nursing, right. So that's a college training program. But regardless of what route you take for training, you've got to pass a test,
exactly.
right?
Yeah.
Now, what's the test like? Do you have to go to Sacramento? Do you take it on the internet? How's the...
You do have to go to a national testing site. They're all around the state. I'm sure there's some in San Jose. I took mine in New York City at the time, but yeah, you have to go. So after you passed your program and graduated, they'll give you a code, and it is on computers. It's all computer-based, and it's a minimum 75-question multiple choice test.
So I think that's important to emphasize. So not only do you have to complete the training in a certified program, whether or not it's in the hospital or community college or at a higher level college, you've got to complete the training, and then you have to pass the test.
Exactly. Same test for everybody, and everyone ends up with the same licensure, registered nurse licensure, no matter what education you have, as long as it fulfills the prerequisites to that test. But
Natalie, I think it's important to emphasize that not everybody passes the first time around.
True.
Isn't that true?
It is true.
It's not an easy test.
No, it is not an easy test.
So I think it's important to emphasize to our audience, whether they're listening or viewing, that to become a nurse, it's rigorous. It's hard. It's difficult.
Oh,
and you've earned it.
Yes.
It's not just handed to you.
Right. No, yeah, and I'm sure times have changed. I mean, medicine is advanced. Nurses have to know so much more, are responsible for so much more than in the past. No longer do we just follow the orders of the doctor. We have to be able to critically think. We have to be able to, ask questions, to stand up for our patients. So it's not just sort of
not just following orders.
Exactly.
Well, Natalie, I appreciate once again you coming on the program. Now, I have a few specific questions about what goes on in the recovery room or post-anesthesia care unit. And I know from my patients that it's a very important time in the perioperative period when they're coming out of anesthesia. So there's a few terms that I want to define for our audience, if that's okay with you. When we talk about the vital signs, like the nurse may write in the chart or tell the doctor the vital signs are stable, what do we mean by vital signs?
Well, vital signs is referring to, I guess, our basic underlying, the heart rate, for one.
Right, so that's the pulse.
The pulse, yep.
Right.
Blood pressure.
Okay. And I know that people coming out of anesthesia, you want to check their respirations.
Right, respirations.
Right.
And their oxygen saturation. That's another.
So those are very...
The four main.
Right. So those are very key parameters to indicate how someone is doing as they're coming out of anesthesia or becoming resuscitated. Isn't that right?
Yeah.
Now, you also mentioned, before we go on and talk about the recovery room some more, you also mentioned that you get the patient ready for the operating room. Now, how does that work?
Well, we bring the patient back. We explain sort of the scenario that's going to take place over the next hour. We hook them up to the monitors to get those base vital signs pre-anesthesia, so we know what we're dealing with when they're done. We know what is normal for them. We might possibly, sometimes people come in and their blood pressure is elevated due to anxiety, and sometimes we tell them not to take certain medications, so we might have to alert anesthesia at that time. We might have some medical issues to deal with prior to surgery, and we start a peripheral IV, so we start that so they can have some hydration fluid, and then we also give antibiotics usually prior to the procedure. And again, like I said, educate the patient, educate the families. They can come back as well. Just get them comfortable before the procedure so that their anxiety is low as possible.
Sounds like you have well, I certainly know, and I hope it sounds to the audience like you have a very important job. And we appreciate your help and hard work very much. I do have another question for you, though, before we go on to talking about the recovery room. What about this term called informed consent? Now, that's a very kind of hot, somewhat controversial topic these days. Now, isn't the informed consent issue dealt with in the preoperative area?
Yes, hopefully most patients have had a consultation with the surgeon prior to their arrival, so they are very well informed about what's going to happen, but they do get an official informed consent document given to them in the front office that has the exact name of the procedure, a description, and then they sign. And we do have patients often that don't sign it. They want to speak to the surgeon again. There's a separate form for the anesthesiologist, so they'd like to speak to the anesthesiologist, so we absolutely do not force them to sign anything until they're comfortable doing it. We as nurses do our best to explain the procedure again, or any questions within the parameters of our knowledge and licensure, but we definitely make sure that they understand everything, the risks, of what's about to happen to them. So.
Right. Natalie, you mentioned how the medical and surgical world has changed in the past few years. I can remember, it hasn't been that long ago, when a patient might not be so informed or fully informed about what's going on. Say they have belly pain. They might come to the holding area or preoperative area, and all they would know is that their belly hurts and my surgeon says I need an operation. They might not be so fully informed. Today, I think it's changed dramatically that we try to give patients a much deeper or greater understanding of what might be going on inside them and why they need an operation, even in an emergency setting. Isn't that true?
Very true, yeah.
And so I think the nurse is actually given a fair amount of responsibility to sort of oversee that whole process.
Exactly, yeah.
And they tell us now that informed consent is not just a signature, it's a real process to go through. So let's go back to the PACU, or post-anesthesia care unit. Now, why is it that we need a nurse assigned to a patient who's coming out of anesthesia?
It's a very volatile period, actually. I mean, they're still very vulnerable. Oftentimes, most times, the anesthesiologist is going to wait till they feel safe to bring the patient out. They've been extubated, they don't have any tubes in their mouth, that kind of thing. But they're still unconscious, oftentimes, deeply sedated. And so, airway is always an issue when you're not able to protect your own airway. You need somebody there one-on-one to monitor that. So that's, one of the reasons that you definitely need a registered nurse there, because we're trained to look for these things.
Now, Natalie, I want to take a minute to talk about that, because this program is for the public.
Okay.
Now, when you say protect the airway, let's explain what we mean by that.
Okay. So a lot of patients, just the position that they're in, they're so relaxed, their jaw can sort of fall open, and their tongue is relaxed and can actually block their trachea, their airway. And so we have, with very simple maneuvers, we have one called a jaw thrust. We literally can just sort of push it forward a little bit, and we'll hold that position for just the few minutes that it takes for them to come out of anesthesia, enough that they can then, what we say, protect their airway. Then they're conscious enough that their body will protect that.
Excellent. And that's one of the reasons why I think it's important to emphasize this concept of vital signs, right? When you brought up the issue of respirations and blood pressure and pulse, those can all be affected in the post-anesthesia time period, isn't that correct?
And are often sedated, yeah. I mean, when blood pressure is lower than normal, the anesthesia just drops everything, slows everything down. So it just needs very careful monitoring, and very rarely does anything ever happen, but we're there just in case it does, and we can turn it around quickly before anything really goes downhill.
You watch them like a hawk.
Exactly.
Also, and you mentioned that there are monitors, right?
Yes, so we're very spoiled.
Right, so no one comes out of the operating room just laying in the stretcher or in the bed.
Oh, no.
They're attached to heart monitors, and you said we can mention their oxygen saturation, and when things get even a little bit out of whack, the alarms go off, right?
Right, and we're right there. We can make adjustments, give oxygen if needed. I mean, just little minor things that really make a big difference. But yeah, monitors are really key.
Right, well, Natalie, how long does it take for a person to come out of anesthesia?
It varies person to person. Everybody reacts differently. Everybody handles anesthesia differently, but I would say generally under 10 minutes.
Under 10 minutes.
At least, yeah, I mean, rarely do we have to, like I said, protect the airway for longer than that. Sometimes people will come out enough to where if you, say, hello, wake up, they'll open their eyes, and then often they just go right back to sleep. But, if you can get them to that point of level of consciousness, then you know that they're coming out. It's fine, so.
And Natalie, something that I've noticed that continually surprises me even now, I've been in private practice almost 20 years, and of course I trained for about 16 years or 14 years prior to that. It's very fascinating to me to be able to give a patient directions and instructions in the post-anesthesia care unit, and they say they understand, and they say, I've got it, and they can even repeat it back to me, but then the next day, they won't recall a thing. And I guess you call that post-anesthesia amnesia, isn't it?
very common.
So that's one of the reasons why we give people instructions in writing. And certainly the nurse can reinforce the teaching and the instructions before they go home.
Right, and we usually do go over them with a caretaker, a family member, somebody else who's not under the influence of anesthesia, so that it's heard by both parties. And then we call again the next day to follow up and just make sure that they don't have any questions, that they really have all the information, that they still have their sheet. So.
Okay, well, Natalie, in the uncommon likelihood or unlikely occurrence when there might be a problem in the PACU, what does the nurse do? Like what do you do? Is there someone you can call, or is there a nurse you can call in for help? Is the doctor around?
Well, I mean, there's many of us in the PACU area, but we're all emergency trained. We all have advanced cardiac life support training through the American Heart Association. Most of us have a background in emergency or ICU experience, so we know what to do. We would go get an available anesthesiologist, hopefully, but we would all know what to do. We could all run codes comfortably. I mean, if no one is available immediately, if everyone else is in surgery, but
okay.
Yep, we all work as a team. There's plenty of nurses around, and then we would, since we're in an outpatient setting, we would call 911 to transfer them to the hospital as soon as possible. But
now, Natalie, there are some patients that we recommend that they stay overnight in the hospital, right? So now you're working at an outpatient surgery center, and I think you said that part of your experience in the past has been working in an emergency room, is that right? So you've had experience in different areas of the hospital and surgery centers, et cetera. Now, why is it that some people will have an operation in the hospital and some people will go to an outpatient surgery center?
Yeah, mostly has to do with their health history. The anesthesiologist often will make that call. I know they have some kind of rating system that they use, but basically if there's any fear that something is more likely to go wrong, then we would keep them in the hospital setting because there is more emergency equipment available and more personnel. But most people are healthy enough to be able to come to outpatient setting, and
they do very well.
They do very well, and we rarely have any complications. So,
Natalie, I get the idea. Well, first of all, I know you're good at your job because I've been fortunate enough to work with you at a couple different surgery centers. But I also get the idea that you really like your job.
Great job, especially in the world of nursing.
Well, that's great. Natalie, we only have a few seconds, but what I'd like to do is close out this segment by you describing, again, if there's a high school student listening who's smart, whether it's a young man or young woman, who makes a good nurse? Like, who would you advise to consider nursing as a career? What do you think the qualities are that makes a good nurse?
Positive attitude, an upbeat personality. I mean, you have to, like I said, like working with people. You need to like to be on your feet, working with your hands, moving about during the day. It's not a job for someone who wants to sit at a desk all day. So it's like high activity level. You're busy as a nurse, but it's never boring. So someone who constantly wants to learn new things, meet new people. You can go there's so many different areas you can go in nursing, and as a profession, it's very open to moving around. So you can always train in something else. So someone, again, who's smart, critically think, make good judgment calls,
and who
work independently.
And who likes people.
Yeah, and who likes people.
And who is capable of working with people. Well, Nurse Natalie Harris, RN, I certainly appreciate you coming on the program.
Thank you for having me.
I'm so glad that you're a nurse because I know you're good at it, and it's great that you like it. Thanks very much for being here.
Thanks, Dr. Morwood.
I am Dr. David Morwood. I'm a board-certified plastic surgeon, and once again, this is Your Health radio and television program. We're going to take a very brief pause for a very good cause. We're coming right back.